for sinusitis,
Yeah,
which would be the drippy nose,
Right.
the dry eyes,
Mhm.
the discomfort in the sinuses. It works wonders.
It's also great for hair.
Oh, that's good
It
to
is.
know.
It is very good for hair.
I think it's good for a lot of things, don't you?
It's good
Yeah,
also
yeah.
for gum problems.
Mhm.
My sister told me, who's a dental hygienist.
Mhm. Okay, you do a lot of herbal medicine as well, do you not, Jean?
Mm-hmm.
Tell us more about that, please.
Well, I got certified by the Australasian College of Herbal Studies back in 1997, and a lot because I would find back in those days there were not that many people on medicines that we knew that the herbs they would have contradictions to. So I became really interested for the grapeseed extract, etc., and all different conditions that people come in with, heart problems, hawthorn, magnesium, and a lot of times we'll use vitamins and minerals along with herbs. I don't just use one thing because there's so many natural things that'll help.
Now, I was talking to an herbalist one time, and she was talking about the different schools of herbal thinking, if you will, the Ayurvedic herbs versus the Chinese herbs. Of course, you've got the Native American herbs and some of the classical herbs. Which of those do you practice? More the classical type herbs?
More the classical.
Yeah, yeah. Okay,
Uh-huh.
fabulous, fabulous. All right. Well, all right. Well, we're going to take a quick break, and we'll see you on the other side with Dr. Jean Chabot.
Very good.
Oh, I stumbled there, and one of those questions was, I got
You
lost.
did great. You did great.
Well, I really got lost. I was like, oh.
Jean, what areas would you like for us to focus on as far as your practice and getting the word out? And we've kind of talked about chiropractic, herbs, homeopathy. I'd like to spend a little bit of time on energy medicine, but what are the ones that you'd like to really emphasize or you think the patients would...
I can tell you what I think. Some of the things that really help, like with fibromyalgia, a special form of magnesium, candida. There's so much candida right now
yes.
in America.
We do that.
We do a lot of work with that. I know because I've sent you some patients that you've had wonderful results with.
Okay.
Like Saccharomyces berberin. Reiki is something I don't do personally.
Okay.
I do it the way I do it.
And welcome back to the Wellness Connection with Dr. McMahon and Misty, and we have today's our special guest, Dr. Jean Chabot. Hello, Jean. Welcome back. So we were talking about all the wonderful things you do, and of course you're a chiropractic extraordinaire, and we talked about herbal medicine, homeopathy. You have so many tricks up your sleeve, and I think it's really powerful when a patient comes in and you have a certain condition and you have all these modalities you can turn to. I know in my experience as an MD, sometimes our toolbox is just too limited, and so I've worked hard at expanding my toolbox, and it sounds like you have over your 30-something years you've worked on also developing a broad range of tools that you can use. Let's talk a little bit about some things that I frequently see, Jean. Like, for instance, a lot of people come in with fatigue, and I find that they have things like fibromyalgia as well. So tell me about some of your experience with fatigue patients and fibromyalgia.
Okay, well, with fibromyalgia, one of the things that we have found to be really successful is a special form of magnesium. It's magnesium glycinate with a malic acid component. We've had a lot of luck with that. Of course, some of these patients also have thyroid imbalances. We don't do blood work at the clinic, but we do know the symptoms and can recommend some thyroid formulas. Of course, I always refer them. I have referred them to Dr. McMahon, which is you, and you had great success with that. There's so many different things that can cause fibromyalgia, even if they've had past traumatic injuries like a car accident, which has weakened their spine and nervous system. And, of course, being a chiropractor, we take x-rays and start working at balancing the spine. And that's what chiropractic is so good at, balancing the spine, since the nerves from the spine go to every part of the body. And just yesterday, one of my patients, after I adjusted him, he got up and he said, "I'm so glad you adjusted all these different places on my spine. There's no telling what we've just prevented. The problems in the future we prevented." I said, "Man, you've got the right idea. That's so true."
Yeah.
So it's just multifaceted now. But one of the things I'm really excited about that I would like to mention is the new decompression therapy machine, which I had an 86-year-old patient come in to me who's been a patient for years and years, who had, according to MRI, almost everything wrong with her low back, from Facet syndrome, degenerative joint disease, bulging disc, and herniated disc.
Well,
I could adjust her spine and give her some relief, but it just kept coming back. She left me to go to a different chiropractor and start this decompression therapy. She came back after, it took her 34 treatments, but she is 86. She has no more pain. She has no more shaking in her legs. I went to the bank, and I got the money, and I got the machine. And now we are just so excited because now, besides treating the spine, we can also treat the discs and have seen really remarkable results. So I'm really excited about that and wanted to mention that.
Well, Jean, I have to plead ignorance on that one. Tell us more about a decompression machine. What is it? How does it work? What can a patient expect to go through when they come in? I know when I go to a chiropractor, they're going to crack me and pop me. I know what to expect, but what do they expect of the decompression machine?
Well, besides the cracking and the popping and the relief from those symptoms, it's a machine where you lay on the table, and according to your x-rays or MRI or CAT scan, we know which level the problem is at. For example, a herniated disc between L4 and L5. This machine has been using fluoroscopy, which is a type of x-ray where you can actually visualize the person's spine in different movements. It actually can, the traction is at the just right level of pull so that it will pull on that exact joint space and open up that disc. Now there's different protocols too. I can set it for herniated disc, I can set it for degenerative joint disease, Facet syndrome, or bulge, and it goes through different phases of decompression. It pulls. It's a very, very gentle traction, but it's so gentle that it allows the guard muscles on either side of the spine to relax so that it allows the spine to get decompressed and pulled. And when that happens, the disc will actually open up and allow nutrients to go to the area. There's no circulation to the disc. After the age 26, there's just no more circulation there. But when you do that opening up, it does allow circulation to come in there and healing to take place. And that is remarkable because I've seen MRIs before and after, and the disc actually, the herniated disc actually going back in. So I'm very excited because we've had such great results with it.
That's great. Does one treatment usually do it, or do they require multiple treatments?
No, I had one little Mexican guy come in 4 times. He jumped up and he said, "Oh, no more pain."
Oh, wow.
And that was wonderful. And right now I'm working on a herniated disc. It took 6 times, and he finally can lay in his own bed again. He finally is, but the average, according to the research, is 20 to 24 times.
Oh, wow.
This 86-year-old lady, now, she had everything wrong with her. It took her 34 times.
Whoa.
So from 4 to 34 times, everyone's different.
By the way, you need to work on your Mexican accent just a little bit.
Oh, well.
Tell us a little bit about yeast and Candida infections, or Candida, I should say. What's your experience with that?
I see so much of that, and again, that's because I had it myself, and I think when you've had something, you really educate yourself, and you know so much more, and you recognize the symptoms so much more. So we have a questionnaire we have patients fill out, and if they're high on the score, then we go ahead and start them on a low sugar, low carb diet. We give them the foods they can and can't eat for 21 days, at the very least. And, of course, everyone loves sugar, so that's hard, especially around the holidays. But it really makes a huge difference. And then we put them on herbs to kill the yeast. Saccharomycin, which is actually a yeast. It was developed in Europe, and you're familiar with that?
I am. Saccharomyces boulardus.
Right. That's one of the things. It's a good yeast that pushes out the bad yeast. And then we have different berberine and argon grape extract. We have different formulas to kill the yeast. And that is amazing, the difference in them. And everything in fatigue, like you were talking about, and digestive imbalances, bloating is a big symptom, and just feeling miserable. So we start them off on that, on a detox, and then we build them up with good nutrition, and hopefully they'll change their lifestyle habits.
Well, I think when we talk about yeast, most people, they automatically turn their thought process to a kind of a vaginal yeast infection, or maybe a fungal nails or something like that. But there's so much more to it. And what we're talking about here, Jean, is more of a